For Marissa Molina, understanding barriers comes from lived experience.
So I had DACA for 9 out of almost the 11 years that DACA has been in place. I can tell you that until I got my first job out of college in 2014, I had DACA, but I didn't have access to healthcare.
Today, she helps others understand that system, now a trustee at Metropolitan State University of Denver and a regional government affairs director for the organization Forward.us. Accessing healthcare is one of the barriers she's been working on.
And I can tell you that from meeting with our immigrant student services director and our students themselves, so many of them are not able to afford healthcare because they can't pay for private health insurance.
But changes proposed on the federal level may soon impact Coloradans here. Information released from the White House explained that the Department of Health and Human Services will propose a rule that amends the definition of lawful presence, specifically when it comes to Medicaid and Affordable Care Act coverage, to include DACA recipients. The goal is to get the proposed rule done by the end of the month. If it's finalized, it would be the first time that DACA recipients are eligible for those health care programs.
And I've worked with institutions of higher ed across the state of Colorado, one of them also being CSU. And one of the things we were seeing with students is they couldn't have their wisdom teeth pulled because they didn't have access to dental insurance.
Forward.us's analysis of federal citizenship and immigration data found that nearly half of DACA recipients in Colorado have no medical insurance.
And that's incredibly important, especially when DACA recipients in our immigrant community carry so much stress and trauma from their own lived experiences as immigrants in this country.
Now, if we look at this from a wider lens, the federal data that they analyzed that we just mentioned there reports also that nationwide, nearly half of people here under DACA in the United States without medical insurance would be eligible to get coverage under Medicaid and the Affordable Care Act if this gets finalized. Jenny, it's also important to note that while DACA recipients may be able to apply for what's called emergency Medicaid, that can be pretty limited, and there's also eligibility requirements there too.
That number of, when we talk about eligibility, hundreds of thousands potentially.
Right, absolutely.
Okay, Luis, thank you.